Have you ever been in the shower and been petrified that something is coming out through the vagina? It could be something called pelvic organ prolapse. Believe it or not, 50% of women who have had a childbirth will have prolapse at some point in their life. But is surgery the only option? Well, in this video, we're going to learn about how you can treat pelvic organ prolapse without surgery. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and pelvic reconstructive surgeon. And in this channel, we talk about everything related to pelvic health, how to fix it, and when to seek help. If you like what you see, please subscribe and also share it with a friend. So let's start with what is pelvic organ prolapse. Pelvic organ prolapse is a kind of vaginal hernia where, because of the weakness of the support structures, essentially the weakness of the pelvic floor support structures, you can have your pelvic organs, which could be the uterus, the bladder, the rectum, the intestines, pushing through the vaginal canal. There are lots of risk factors for why pelvic floor muscles can weaken. There are common things like age, menopause, trauma from childbirth, pregnancy, people with chronic constipation, chronic cough, genetics, obesity. So all these risk factors can contribute to weakening of the pelvic floor and essentially leading to pelvic organ prolapse. But the good news is pelvic organ prolapse is not life-threatening. It can be scary, especially if you don't know what it is. I have patients coming to my office petrified because they don't know what's coming out. Is it an organ that's just going to fall out through the vagina? So it can be really overwhelming. I made a separate video that talks about what it is that comes out through the vagina and what are the different kinds of prolapse, so please check it out. And yes, surgery is the most definitive treatment options, but having said that, there are lots of amazing non-surgical treatment options that can help improve your prolapse symptoms, and that's what we're going to talk about today. So the number one non-surgical treatment for prolapse is to help improve the strength of your pelvic floor muscles. Now, a lot of the times when we think about pelvic exercises, we exclusively think about Kegel exercises. And that's correct. A lot of pelvic floor exercises is Kegel exercises, but it's not everything. And also with regards to Kegel exercises, you'd have to know how to do them right. It can be difficult because your pelvic floor muscles, unlike the muscles of your abdomen or your biceps, is inside the body. So you can't really see it. So it can be difficult sometimes to know whether or not you're doing your Kegel exercises right. I did a whole other video that talks about how to do your Kegel exercises right. I will link it in the bio below, so please check it out. Now, the thing to understand about Kegel exercises, just like any other forms of exercises, is that the money is in the repetition and doing it the correct way. So it's not something that you do once or 2 times a day and then expect great results the next day. It is something that you have to keep at it. So consistency and doing it repetitively, as you get better and stronger over time, you will notice improvement. When I talk to my patients in my office about how to do Kegels, I usually tell them to do it in 15 sets and do 2 to 3 repetitions throughout the day. So give it at least 2 to 3 months of good, proper Kegel exercises before you can start noticing some improvement of your symptoms. Number 2 is the use of something called pessary. P-E-S-S-A-R-Y. So a pessary is a kind of vaginal insert. They come in different shapes and sizes, and the idea is that we put it in the patient's vagina and it helps push the bulge away. So it doesn't fix the problem, but because it's an insert that pushes that bulge away, it can help improve patient symptoms of heaviness, that fullness, that feeling of something coming out through the vagina. So the pessary is made up of silicone. Again, like I said, they come in different shapes and sizes. The most common one we use looks like a little ring, looks like a little silicone ring. And if you Google images, you can see what I'm talking about, but you have to get it fitted by your physician. So if your OBGYN has experience in it, they can fit you. If not, you definitely want to go to a specialist, a urogynecologist, who will do a vaginal exam and come up with the right size and shape for your particular prolapse. Now, the thing with pessary is that it's like getting fitted for a dress. So it's not one size fits all. So when you come to see me in my office to get fitted for a pessary, we start with doing a good vaginal exam. We take measurements where we're measuring your vaginal length, the width of your vaginal opening. We also try to identify what kind of prolapse you have. Then once we have a good idea of what your prolapse is, what degree your prolapse is, and what's the caliber of your vagina, then we can come up with a shape and size that fits you. Now, we want to make sure that the pessary is large enough that it's taking care of your prolapse, but not so large that it's rubbing against the vaginal wall and causing discomfort. So we want to make sure it's comfortable for you, because if you're not going to be able to tolerate keeping it for long periods of time, then unfortunately it's not an option. Number 3 is lifestyle modification. Remember at the beginning of the video, we talked about various risk factors that can make prolapse worse. So things like constipation, chronic cough, obesity. All these are risk factors that can be mitigated and help with improving your prolapse symptoms. So for my patients with chronic constipation, we talk about starting them on some stool softener, increasing their fiber intake with lots of water to help make them go more smoothly. The recommendations are to do 30 to 35 grams of fibers every day. And a lot of the times, even if you have the healthiest diet, just fruits and vegetables alone may not make that mark. So adding a fiber supplements, most of which is available over the counter, and just pick something that you like, take it with a lot of fluid so that it can help you go more easily. Chronic cough, so if you're an uncontrolled asthmatic or if you have any other lung issues and because of which you're having this cough constantly, addressing those concerns can help improve your cough and as a result improve that constant pressure on your pelvic floor. And obesity, it causes lots of diseases, but specifically to pelvic organ prolapse, that constant pressure on your body can put a lot of pressure on those pelvic floor muscles. So reducing your body weight, even with just modifying your diet and regular exercises and walking, can help improve your symptoms. Now, if you are somebody whose work or whose everyday lifestyle involves doing a lot of heavy lifting or standing on your feet for a long time, those can also contribute to pelvic organ prolapse. So my patients who are hairdressers or who works at cashier where they're not able to sit all the time, those are risk factors because that constant standing and gravity kind of pulling at those pelvic organs can also help exacerbate your symptoms. So again, being able to modify those symptoms. Of course, you cannot leave your work, but maybe have your doctor write you a note where you need to sit for a little bit of time as opposed to standing constantly. And if your work involves doing a lot of heavy lifting, maybe cutting those down a little bit can also help your symptoms. Hope you found this video helpful. In our next video, we're going to be talking about surgical treatments for pelvic organ prolapse. So please check it out.